Hi, my name is Jim Joye, and I'm here today with Chris Metzger, interventional cardiologist. And we're really excited to have Chris here at VIVA again this year. He's really a rising star in the field, and I'm going to ask him a few questions about VIVA, about life, and some other related topics.
Okay.
Thanks for being here, Chris.
My pleasure. Thanks for having me.
Absolutely. So maybe for the folks assembled, your first exposure to VIVA, what you kind of took away from it the first time around, and what made it something that you wanted to be a part of?
So before being faculty, years ago, when you wanted to learn peripheral intervention, you came here. Multidisciplinary approach, and you can truly see both the science, but the science in action. So you have intimate groups where you can get close to faculty and ask real questions. You can see live cases. You can see how different specialties work together and yet come out with a good outcome. And so 10 years ago, you came here to learn, and now it's a true opportunity to continue to come on. It's a one don't miss meeting every year.
So for me, I know that there's usually one or two things that I take home from each meeting. You know, something that just I wasn't doing before, I wasn't thinking about before, somebody's up there talking about, and I take it home and make it a part of my practice. Maybe something in the past couple years that you would say was a take-home point that changed how you practice?
Absolutely. As you watch other innovative operators, like yourself, for example, but you look and see, for example, a stent that couldn't be crossed from above, doing a direct thigh access of that. I like to think I'm innovative. I wouldn't have thought of that. To go from a tibial access, not be able to meet in the middle, but puncture that balloon from below with a reentry device from above, externalize the wire. Again, these are things that you take home from the meeting, realize the common sense behind that, and then apply it to your own practice. So I think those are invaluable aids to each one of our practices once we leave the meeting.
That's great. That's great. Yeah, I look forward to seeing what new tricks we'll learn this year.
Yeah, no, for sure.
So you've gotten increasingly involved, you know, very high enroller in a number of different trials. Maybe you could just talk for a minute about the studies that you're currently engaged in and what excites you about those.
Yeah, for me, clinical research is kind of like the dessert of the case. The case is the meat, the research dessert. We're in the drug-coated balloon trials. We're high enrollers at Levant 2, the Access Registry, Impact, and so on. And so we get to see that technology that you and I can't have for a while. Randomized trials, for example, Act 1, to show that we think carotid stenting in capable hands is comparable to carotid endarterectomy in standard risk patients. You know, those, to be able to contribute to the science and the information there and have access to cutting edge technology is an important part of what we do. We really have a lot of fun with research enrollment.
Great. Well, you've certainly had a chance to see how VIVA's evolved over the years. Wondering if there's anything in particular this year that you're, you know, a sector of the business, something that you know, you're looking to even expand further into. Is there a certain area that you're, you know, going to chase after this year?
You know, I think that there are areas that we might not think about otherwise. Some of the regulations and the vascular medicine specialty and appropriateness criteria, that there are dedicated sessions here that are outside of the usual box of what we do. I think those are important. And then I still think you combine a lot of innovative sessions like the Blitz, where you can sit down with a table of 6 folks and go through a case step by step. So you take both things outside the box and then things right in your area of where you want to get better at, and take it all home with you. So I look forward to all of those.
Okay. So you're a ridiculously busy, high volume guy, but you're obviously in touch with what's going on in the trenches as well as the podium. You know, we're in the accountable care era, we're in the Sunshine Act era, we're in the affordable health care era. How do these things affect, or do you foresee them affecting the way you do business in the next 5 years?
You know, I think they're going to affect us whether we like it or not. I think if we're honest, hard-working folks, the Sunshine Act, if done correctly, won't hurt us much. I don't mind telling somebody I got a small fee for work that I've done. I don't think there's anything wrong with that. as long as they can not put, for example, research trial, put that as money that I earned when I didn't see a dime of it because I do it for free. As long as they can work out those bugs, Sunshine Act doesn't bother me. I think that we all want to do what's best for our patient as cost effectively as we can. And that should be a goal. Now, there may be a time that you have to spend a little bit more money to get a good result in a complex patient, and hopefully the system will allow that. I have to have the positive optimism to believe that that will be the case, and I think it will.
Good. So outside of the medical world, you need a break from time to time. What does Chris Metzger do for fun?
Boy, yeah, I have 3 wonderful kids that are now moving to different parts of the world. So get to go watch the Clemson Tigers with one son, and they're having a great year. Another son is culinary school and moving out west, so you visit him. And it's still a sweetheart of a daughter who's 16 and still wants to spend time with her dad. That's first and foremost when we get out. I have a Harley. I like to ride. Tennessee's got beautiful country, and the outdoors are nice. And so those are a few of the things that you like to do.
Excellent. Well, I really appreciate the time today. I hope you have a great meeting.
Well,
certainly encourage everyone out there to stop Chris and pick his brain. He's a bright young guy and he's got a lot to offer. So thanks, Chris.
Thanks. I like that young part. Thanks, Jim.
You got it.